back. This is Boomer Life on CL 650.
All night long. All night. All night long.
Snore all night long.
Some do.
We're speaking with the SnoreDentist, Dr. Charnel Muir, about snoring, sleep apnea, and, that song we could take either way. You want to get a good night's sleep all night long, or your partner's thinking, I have to live through snoring all night long, right?
Yes, definitely.
All right, so you specialize as the SnoreDentist in oral appliances that help open up the airway at the back of your mouth and into your throat by moving the jaw forward just a little bit, right? The lower jaw. So this seems to me that it would be uncomfortable, and you must get that resistance. So tell us what the perception of your patients is versus the reality.
Right. Well, the reality is people wear them. I mean, their patients will be able to wear it through the night on average in the first 1 to 3 nights. It's not something that's difficult to get used to. For most patients, if they move their jaw forward and hold it there, their muscles have to do the work. Their jaw will tire. It'll get sore. Their muscles will fatigue. But this is moving your jaw forward for you, and you're resting there. So your jaw muscles aren't at any way doing the work for you. So it's a passive therapy. It just holds your jaw in a slightly forward position, but it's in the normal range of motion of your jaw.
So it wouldn't affect your jaw in any way? Like, do you get any people that say my jaw's sore?
Yeah, we get some patients, we get about 3% of patients that can have a temporarily stiff jaw in the morning. They'll maybe get some soreness in a muscle or soreness right in front of their ear. Most of those patients are probably my grinders. If they're going to grind on their appliance, imagine their jaw's in a different position and they're exercising. So it's used to exercising back here, and now it's exercising forward of that.
So instead of exercising with running shoes, you're doing it with dress shoes on.
Right.
Getting a different outcome, right?
That's right. So you get a sore muscle, like a sore muscle from the gym, but it's been shown to be temporary, and it does go away with time. The other thing that some patients will have is a temporary change of bite in the morning. So it's almost like a jaw stiffness. They'll take their appliance out and their lower jaw will close in that forward position instead of going back to their chewing bite. And again, temporary, recovers on its own, but it's important that it does. You do want your jaw to go back so you can chew on your back teeth in the morning.
So describe again how much you're moving. For those of you who are just joining the show, we're speaking with the SnoreDentist about oral appliances that move your jaw forward just ever so slightly. So walk us through the millimeters of this, because it sounds like, my bottom jaw is going to be sticking out, but that's not the case.
No, and most jaws, as I said earlier, will move forward to back on average 10 millimeters. So we will start most jaws forward 5 millimeters. It's not a large movement at all.
So 10 millimeters is a centimeter.
Yeah.
So
half of that.
Half of that,
yeah. So it's not a big movement, but it's enough that it improves the airway. And by holding the jaw forward the way the appliances are designed, it prevents the jaw from collapsing back. Now, the base of the tongue is attached to the lower jaw, so it comes forward for the ride. It doesn't really have a choice. And then we prevent it from falling back, especially when you back sleep. If you have that gravity going and that jaw falls back, that's what we prevent as well.
Okay, now, how comfortable is this? I would imagine you've got it in, but you're not asleep and you still want to swallow and maybe talk for a little bit in bed. Yeah. So how does it obstruct your lifestyle?
Yeah, you can talk with them in. Sometimes it'll take a couple of days to get used to how to speaking with it in place. Some of them have completely unattached top and bottom, so you could yawn fully with it in. It doesn't obstruct you in any way. Some of them, you won't be able to yawn fully, but you can still open and close. You can still drink water with them in. You can have a conversation, because your bed partner always asks you a question as soon as it's time to go to sleep, and you have that in your mouth.
I say to my wife, okay, it's time for bed now.
Are we done?
Yeah, it's time for bed now. Nighty-night, off to bed.
Yeah, so most people function very well. Because they're custom made, they're also very comfortable in the mouth. They're form-fitted to just your mouth.
Now, does this affect your saliva at all? Are you overproducing saliva? Something's in your mouth?
Yeah, I would say about half my patients to 60% of my patients will have a little bit of extra drool at night for about 2 weeks. So it's your brain thinking it's food.
Right.
Why else would you stick it in your mouth, right? So it'll produce that saliva, and that'll dissipate in a couple of weeks.
And the learning curve of your brain and your body is how long typically before someone really gets used to this?
Like I said, 1 to 3 nights. I always say to the patients, in the first 1 or 2 nights, if you wake up in the middle of the night and it's bothering you, take it out. But usually by night 3, most people are wearing it right through the night.
Now, I could imagine that this is a discreet way of not snoring. You don't want to cart out your CPAP machine when you're going on a golfing trip with your buddies, for example, or going fishing on a cabin somewhere.
Or starting dating.
Yeah.
I have several middle-aged men and women that come into my office that go, I know I snore and I'm dating again and it looks like it's getting pretty serious. And I don't want that snoring to be a problem.
So how does somebody typically use this device? They brush their teeth, they're in the bathroom, they put it in then, or they keep it next to the bedside table? What do you tell people?
Yeah. Well, I often tell them my own personal experience because I have worn an appliance for several years. I've worn any kind I dispense to a patient. I've tried myself. All, huh? And I was the cliche, started snoring after menopause. My husband said, honey, you're snoring now. And I said, oh, no, you're just a light sleeper. But no,
That sounds very familiar.
I had started. And so for me, I often will read a little bit in bed.
Sure.
So I'll brush and floss my teeth. I'll bring my appliance to the bedside in its small case because they just come in one of those small travel cases.
Like a retainer,
Like
right?
a retainer case. And then when I'm done reading, I'll put my appliance in and be off to bed. For some patients, they put it in the bathroom, head to bed, go right to sleep. Yeah, it's just that easy.
We're speaking with the SnoreDentist, and it's SnoreDentist.ca, Dr. Charnel Muir, located in North Vancouver. But you visit other clinics around the Greater Vancouver area, right? So you visit one on West Broadway?
Yeah, so I see patients at 805 West Broadway in a clinic there called Clinical Sleep Solutions. They're actually a CPAP provider.
Okay.
But they have patients that discontinue CPAP or aren't appropriate for CPAP. So they felt it important to provide alternative care. I also sometimes see patients out in the valley. I will try to get out to the Abbotsford or White Rock area 3 or 4 times a year. And then I go to Vancouver Island. Because
you're really quite rare, very rare, I would say, here in dentistry in British Columbia, because there's only 5 of you with this...
this diplomat.
Yeah, this certificate for, I'm not sure...
Dental sleep medicine.
Dental sleep medicine. And some of you are retiring, so there may be only 2 left, and you're one.
I think there's only 2 of us that are under the age of 70. Yeah, so...
You've got a long, long way to go.
I've got a few years, for sure.
And when somebody comes into you and they've been prodded by their spouse and they're dragging their feet and they don't want to do this, and tell us the before and after, not only for the spouse who's getting a good night's sleep because their partner isn't snoring, but their quality of life. Can you give us some before and after stories and how quick it is?
Yeah, and I just got an email the other day. We delivered an appliance to one of our lady patients. She came in because her husband complained she was snoring. I got an email the next morning that said, I can't believe it. I was quiet as a mouse on night 1, not a single sound. And, they just can't be happier. Now, we haven't even assessed fully effectiveness of that appliance yet, but the symptom of the snoring, the disruption of the snoring was gone by night 1. Not everybody's night 1. But most patients will have a dramatic effect of their snoring within that first week of wear. And they'll start waking. They'll be less tired. A lot of my patients come in pretty grumpy. Mm-hmm. They're not sleeping well. They don't know why. They just feel tired and grumpy. And, I see them back at a 1-month follow-up and they're friendly and they're smiling and it really affects their days.
Well, I got one for you because my dad has always suffered from insomnia. Big snorer, right? Now he has a CPAP machine. I said to him, are you still waking up and reading books for 3 hours because you can't get back to sleep? He goes, oh, no. I sleep through the night now.
Yeah.
So is insomnia part of sleep apnea?
It can be. So what can happen is you can wake up during night because of the threat of the sleep apnea. So every time you have a sleep apnea event, your body goes through fight and flight. It thinks the big mammoth is strangling you, so it wakes you up. And so what
Sometimes you
happens
don't
is,
fully awake, though, right? Yeah.
No, most of them you don't wake. But for some patients, you'll fully awake. And then your body has adrenaline in it. And it's been, it's had that fight and flight response. Well, it's hard to get back to sleep from that point. So it can take some time.
And then you really feel tired.
And then you're really tired.
Is napping a sign? Because I love me a good nap.
Well, and I often get on even follow-ups from patients. They'll say, I'm sleeping well. I don't have daytime fatigue. I'm waking rested. I don't have my morning headache anymore, but I still nap because I can. So,
good for you. That's what I say.
Yeah.
You ever close the door in your office and put your feet on the sofa and say, I'm out of here, 5 minutes?
Just because I can.
Just because you can.
Yeah.
I think more doctors should prescribe naps, snoring or not.
I know. Napping can be a good thing. Yeah.
Well, this sounds like a major revelation for me and a lot of people. Now, I snore. I know I snore. Like I said, I've never heard it myself, but I'm told I snore. So I think I'm going to make an appointment. And so people can go online and make an appointment?
Yeah. We've got an online appointment button on our website. And patients can come in for a consultation no matter what stage they're at. If they just snore, if they're not sure they snore, if they know they have apnea, if they're CPAP intolerant, if they want a travel alternative, whatever that is, the patient can come in for a consultation. There's no charge for that. Just come in, find out if we can help you. If we can't, we'll let you know.
It's the SnoreDentist, and SnoreDentist.ca is the best way to find out, and you can go on and make that appointment if you want. Dr. Charnel Muir will continue our conversation about snoring. Good times. Next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.